Hey guys, I'm Sebastian, part of the locally world famous chiropractors in Orange County, California. I'm going to cover today lower back pain in more of a reference point from the mobility stability model. And this thing can cover things like disc herniation, sciatica, pinched nerves, things like that. There's a lot of different ways the body can express itself through having mobility and stability issues, okay? So I'm going to use this model here, and again, this is a very generic way of thinking of it, but actually when it comes to rehab, actually this is a very good way to look at it to be able to formulate what you're going to do next and why you should not always address the squeaky wheel, in this case the lower back. Now obviously there are things that we could be doing for the lower back to improve the way it feels, such as ice and heat and all those things like that, but really when it comes down to it, we need to be able to offload the lower back to allow it to settle itself down. It's almost like you've been out in the sun too long and you got a sunburn. The solution is not necessarily going out in the sun longer and then putting on aloe. Perhaps the solution is to get out of the sun for a couple days and then supply the TLC needed to offload the area. And so in this scenario, we're looking at the lower back usually moves a little too much, and it tends to create some issues. It's required to do too much. And I've written some other articles where we talk about energy leaks, where basically you're getting energy to go through an area that can't tolerate it, and it tends to create squeaky wheel or issues. A lot of times movement dysfunctions can reveal some of these too. Assessments are good ways to look at these. And now, so one of the common things we find, at least with lower backs, is that we find that a lot of times people's hips don't work extremely well. Now, how would you know that your hips don't work well? Well, that's a good question. I think it's kind of complicated because oftentimes they don't hurt even though they're not working well. And so a lot of times a basic squat pattern is an easy way to figure it out, and just seeing if you're actually able to put weight on side to side. Or generally, if you've been staying away from using your hips or even lifting stuff, then a lot of times it's logical to think that these things have been deloaded, we'll call it that. Now, this area here, if you see the hip, I'm going to turn this guy a little bit. This is Bob Norman. I'm gonna swivel this hip around a little bit here, as you kind of can see. We'll turn this camera down. And you'll see that this hip actually spins really well in this ball and socket. This is a normal hip anatomy. There's no arthritis in this hip. There's no labral tears. There's nothing like that, okay? Obviously, those are things that complicate the issue a little bit. But generally, if there's not really pain in the hip, no painful clicking or popping or no like fixated points, it just doesn't really load as well as it could, then I think we can actually take this as a good sign that we can produce more mobility in the area to deload the back, okay? Now, movements like bending forward, okay? This guy's facing me now. He's going to bend forward. He can bend forward from the hips a little bit, or say sitting even from the hips, and less from the low back, or he can choose to do it more from the low back and less from the hips because he's not using his hips, okay? And in that scenario, we actually want our lower backs again to become more stable, as we talked about it through the mobility stability model. Now, if the hips have a lot of movement options and a lot of movement availability, we might as well use them, especially when we're trying to settle the spine down. We're trying to cool stuff down here and make it so some of these stability exercises actually stick. Because if you're trying to add stability, but then you keep requiring mobility because you're not addressing the root cause, it's a little bit hard to get those things to stick. Okay, so what we suggest a lot of times is getting the hips to move better. Okay, there's a series of exercises that usually work pretty well. We also like the hip to become strong and stable, or else it won't move. I know it's getting confusing here, but generally, if this area here is not stable, it also lacks mobility too. And so contracting and getting the musculature around it to work really well, the glute max, the medius, the piriformis, the adductors, all those things, working in a nice organized fashion, actually your mobility improves dramatically on its own without doing any stretches at all. Now, how does that relate to the back again? I'll keep reverting back. I'm going to sound like a broken record here because it's sometimes confusing, but if we generally think from a mobility stability model, it's actually pretty simple. We need this area to move well, so this area moves less, at least for a period of time. We don't want to tell people actually that they can't move the spine ever, but they've been trying to move and stretch their spine for months and months a lot of times, and they don't generally feel better. If they do, it's probably very momentary. So we suggest addressing this area here first, or another adjacent area. Another adjacent area is the section of the spine that's above it, such as the thoracic spine, again, which is a mobility area. It's an area that requires, it has the capacity for a lot of mobility that will spare the lower spine from moving too much, okay? So what are some examples that maybe make this a little bit more confusing, a little bit more challenging for people to regain the ability to feel good in their low back again? Well, if you have ongoing problems in the hip, a lot of times the area around it, the bones and so on, will start to respond. They'll start to respond in a way to help you out, which will look very bad probably on things like an image because it'll present as something like arthritis. Now, obviously, there's other reasons for arthritis. There's, I think, 100 types of different arthritis of the body. But generally, the old age arthritis, we say, is a little bit more of load-based. And the bones respond to the requirements you put upon it, just like muscles. If you want to get big muscles, you got to put some load upon it. Now, the bones here are trying to help. They're trying to stabilize. And over the course of time, you might find that, well, that hip's been an issue for a long time. Now it feels good though, but now I have arthritis in it. And so now I have a little bit more restricted movement, like I have pinching when I try to sit deep. That pinching will start to bring more movement to the spine here. Now, how do you reverse this arthritis? Well, you can't get rid of the actual bony change, but we can certainly improve movement in the area if we build stability around it. Okay, I know it sounds crazy because a lot of people have been led to believe that arthritis is kind of like a death sentence to them. It's not, okay? There's a lot of things you can do to improve the function of the joint, which will improve the function of and the way the other surrounding areas feel, okay? Generally speaking, though, areas that tend to be the cause of, say, low back pain tend to not really hurt, okay? The hips don't tend to hurt, although the musculature around the hips will tend to hurt, but the hip joint itself won't necessarily hurt. The mid-back won't necessarily hurt either. Let me regress one more time, because maybe a lot of you might be thinking, well, I do have pain in the buttocks area, in the groin, and a little bit. Yeah, this can also be referred from the spine as well, and actually very commonly is. Even sciatica, which people are familiar with, which is pain down the leg, can be referred from the spine. So it can very much mimic areas of the hip, which might, I guess, normally not be painful, but then it's masking it over the top. So let me clean this up again and make it less complicated again. I like to be thorough where I can, but I know we get in the weeds, it gets complicated. Generally speaking, if you want to improve the way that your low back feels, you got to improve the way the hip and the mid-back feel, or the mid-back function. They need to be able to move because they're areas that have a lot of capacity of movement. This area here just wants to do its job. It just wants to be generally stable, and it wants to be able to be a center point of stability for you. But if you don't allow it to do that because you're making it do the other parts' jobs, you're going to have a problem for a while. So, hope that was helpful. By the way, if you're watching this on YouTube, we do have a lot of other YouTube videos on this topic. You can subscribe to the channel, hit the notification, and search the bar, which will get you to where you want to go, okay? You can search anything you want to on our channel. See you guys next time.